Hi, Erin here, doing pack 20 for performing a PCV and total protein. So today we're going to run an in-house test for a PCV to monitor a patient's blood count and the total protein. So I've got my EDTA tube here with the patient's pre-collected blood, and I'm using a 1 ml syringe. I'm just going to draw up a small amount of the patient's blood. Okay, and then we're going to get out 2 of our hematocrit tubes. So you need to run 2 of these for not only just to get an average of the patient's PCV and total protein, but also to balance your machine as you're running it. So with this one, I'm going to get a small amount of blood to the tip of the syringe there. And then I'm just going to pop the hematocrit tube on the end there, and we're just going to feed it in there. We'll do the same with the second one. Okay, and with that one, I'm then going to put the bung in it, so you just put the plug in by placing in the putty there like that, and that should come up like that. We'll do the same with the second one. Just like that. Then we're going, once we've got our samples there, we're going to pop them in our centrifuge up here. So, I'm going to start by unscrewing our lid here. Just pop that one there. Then you want your hematocrit tubes to sit opposite each other to balance the machine out, and you want to sit them in there nicely with the bung on the outside, so then when the centrifuge spins, it doesn't just spin your sample out. So then we replace our lid, make sure it's on nice and tight. Then we'll shut the centrifuge here, make sure it's on your micro hematocrit setting, and we'll press the green button to start. Sometimes with this one you have to hold a little bit of pressure on the lid till it's... Okay, so our sample is finished spinning, so now we're going to get it out. So we'll press this little red button here to open the lid. You'll hear the click. We'll open it up here. Now for this one, we're going to pull the center of the centrifuge out, and we will read our PCV. So we want to line up the bottom of our bung here and the top of the serum. So we're looking at a PCV, so we're reading where the red blood cells sit to, the packed cell volume. So PCV of about 60 on that sample there. Then we'll flick it around to where our other sample is sitting. Also sitting around 60. So that is a little bit above the average. So this could be due to the fact that the dog was dehydrated. So we did run some bloods and did indicate dehydration as well as clinical signs of dehydration. So once we're done here, then take our samples out, pop this back in the centrifuge. That back in there, ready to use again, and we will pop that one in the sharps container. Just pop this one away. Erin here, doing prac 20, performing a PCV and total protein. So we've just run our PCV, which was 60, so a little bit above normal, which is 55 for our max range. So for this one, we need our refractometer and our micro hematocrit tubes that we've got here with the serum still in it. So using our refractometer to calibrate it, we pop some distilled water underneath the lid onto the measuring prism, then we can adjust that dial there, and your reading will want to be 1.3330. So that's your baseline reading. So to do our total protein, we want to break our microhematocrit tube just above the buffy coat, so we only want to get the serum, no red blood cells in that one. So we'll break that one there, and we'll just tap it onto the lid here to get our sample out. Okay, and once we've got our sample out, we'll close the lid, pop it up towards the light. So for our reading, we're looking at about 80 for that one. So it is a little bit on the higher side of the parameters, like it is on your max range. So again, this could be due to the dehydration. So once we're done with our microhematocrit tubes, we will pop these ones in the sharps container here. Our EDTA tube that we use for the blood sample, we'll pop that on our little rocker, just in case we do run any more diagnostics. Pop our PCD microhematocrit tubes away, and our putty. This one I'll pop in the biological waste bin. And to clean our refractometer, we just want some of our optical tissue. So we'll just open that up, give it a nice wipe there, nice wipe there, so it's nice and clean. Can also use a little bit of alcohol wipes and then clean with the optical tissue afterwards as well. And then we store it back in the box and pop it back where it belongs. And put that one back up in there. All done. These results are then recorded onto our patient's file and onto their surgical paperwork as well, just so that way it's recorded hard copy and on our system as well for later reference.